So I'm Pat Roush, and I'm a pediatric audiologist, and I work at the University of North Carolina Hospitals in Chapel Hill, North Carolina. I've worked with children for many years now, and we see on average about 4,000 children a year to evaluate hearing. There has been concern based on the work of many investigators, including Pat Stelmachowicz at Boys Town National Research Hospital in the U.S., regarding the limited high-frequency capability of modern hearing aids. And that's a particular concern with infants and young children who are trying to develop speech. So we were pleased to see some interest in the development of hearing aids who have the capability to provide high-frequency audibility for children. And when the new hearing aid came out that had the frequency compression, we started to use that about a year ago. We're fitting it on children of all ages now, and our experience has been generally quite positive. Whenever we're fitting something that's new to a young child, we're going to want to monitor that child very carefully. We're going to want to look to make sure that the hearing aid's been adjusted properly, that it's verified properly, and that the therapist is interacting with us so that if there are any negative effects, we're going to see those. You know, one of the challenges in fitting infants or newborns with any hearing aid is that we really don't have the ability to, at this time, do studies on newborns. In fact, we don't have the ability to do really adequate studies on even toddlers or young children. But yet, we don't want to provide new technology without some evidence in younger people. So really, the best thing that we can do is to first do our studies in adults. And if the particular technology is looking promising with adults, then we're going to try to do older children. And in this particular case, studies have been done in adults and some older children. And yet, as clinicians, we're called upon to fit hearing aids on infants and very young children who are just months old. So in the case of frequency compression, right now we have some studies that show us that the technology has been useful in providing high-frequency audibility for children and for adults. And so in our clinic, we do feel comfortable in applying this technology to younger children.